So monoclonal antibodies sort of lie behind a lot of these revolutionary cancer treatments you're talking about. They obviously have trouble getting across the blood-brain barrier. I mean, what are the advances that are going on there to try and get them to the site?
So yeah, no, it's fascinating because this whole idea of the brain as of a battleground is really emerging. And big molecules, it's really hard to get them across that barrier. So antibodies may not be the best way. When we started to do this, no one had any idea actually how to develop a drug in the brain. They didn't know whether you had to inject it into the fluid around the brain, and if you did, how often would you have to give it? And, how do you sample the fluid to see the level? So it's really kind of in its infancy. One of the ways where an antibody has actually worked was those immunotherapies that I talked about, and these drugs actually, their target is actually the immune cells, which are around in the rest of your body, and you activate them there, and then they wander into your brain. The drug doesn't have to go. You just, kick the immune system into action. So, but yes, for everyone else, it's going to be a bit of a problem in delivery.
So you have a leaky, if you inhale or use the nose, isn't there a leakage there, or you can?
Yeah, but
no one's looking at nasally to try and get them across that barrier.
But again, you've got to think, well, the solution isn't, like, for example, people often say, why don't you have like an asthma inhaler for lung cancer?
Yeah.
And the problem is, anyone who's used an asthma inhaler, most of it ends up in the back of your throat. And so it's, just because you're vaguely aiming at the lungs doesn't mean you're actually distributing it. And the same if you shove the thing up your nose, it's not getting to the tumor at the back of your head.
Yeah.